Supporters of euthanasia and physician-assisted suicide, PAS, contend that terminally ill people should have the right to end their suffering with a quick, dignified, and compassionate death. They argue that the right to die is protected by the same constitutional safeguards that guarantee such rights as marriage, procreation, and the refusal of termination of life-saving medical treatment. However, there are opponents that say doctors have a moral responsibility to keep their patients alive as reflected by the Hippocratic Oath. Today, I will discuss with you what exactly assisted suicide is, what terminally ill patients go through, what the laws are pertaining to assisted suicide, and why it's okay and should be legal in all states. First, let's talk about what exactly assisted suicide is. There are two types of assisted suicide. The first type is euthanasia. Euthanasia is the act of bringing about the death of a hopelessly ill and suffering person in a relatively quick and painless way for reasons of mercy. The second type is physician-assisted suicide, which is the voluntary termination of one's life by administration of legal substance with the direct assistance of a physician. Both of these have similar goals, but they differ in whether or not the physician participates in the action that finally ends a person's life. The physician provides the necessary means and information, and the patient performs the act. Assisted suicide is only for the terminally ill patients, such as patients diagnosed with cancer or etc. Now that I have explained what assisted suicide is, I will tell you what terminally ill patients go through. Many terminally ill patients go through periods of illness, interferes with desire or ability to eat or even drink. Among the most common cause are the side effects of cancer, chemotherapy, and reversible physical abnormal involving the mouth, throat, esophagus, stomach, or intestinal tract. During these periods, a feeding tube is put into the patient. Throughout history, natural death from terminal illness was accompanied by dehydration and malnutrition because of the tendency of patients to stop eating or drinking. Terminally ill patients with brain cancer can potentially develop morphine-resistant pain, suffer personality changes, and verbal, digestive, and motor loss of virtually any kind. Have any of you heard of Brittany Maynard? Brittany was diagnosed with brain cancer. Brittany suffered from frequent seizures, head and neck pain, and stroke-like symptoms. So many people with all types of terminal illness suffer in different ways, at different times, and all have different symptoms. Now that you know some of the things terminally ill patients go through and experience, let me tell you about the laws that pertain to assisted suicide. In 1997, the United States Supreme Court ruled that there is no constitutional right to assisted suicide, leaving states free to pass laws specifically prohibiting it. There are 3 states that passed laws legalizing assisted suicide in certain limited circumstances. Under Oregon's Death with Dignity Act, physicians can prescribe lethal medication that will allow terminally ill individuals to end their own life. Vermont and Washington State also have passed laws making it legal to utilize assisted suicide. Montana has also passed laws pertaining to assisted suicide, but only via a court hearing. Now Mexico also passed this law as well. Now that you know what the laws are regarding assisted suicide and what states allow it, let me tell you why it should be legal in all states. It should be allowed in all states because it should be up to each individual how they want to end their own life. Terminally ill patients are in a tremendous amount of pain, and assisted suicide will end such horrific pain. The patients can die knowing that it was their choice, and they can die with dignity rather than a shell of their former self. Assisted suicide will spare the patients, as well as their families, a lot of emotional pain. Instead of families watching hopelessly as their loved ones are dying, the nurse or doctor can move on to another patient that has a chance at living instead of spending their time helping a terminally ill patient. The health care costs can also be reduced. Vital organs can be saved and used to help other patients. Assisted suicide can help prevent patients from committing suicide in other messy, horrifying, or traumatic ways. In conclusion, assisted suicide will only benefit a terminally ill patient. Yes, they should be encouraged to live out their lives, but they should be able and allowed to have the option to do so. It is no different than a patient choosing not to live on a ventilator or as a vegetable. If they can choose, why can a terminally ill patient choose? Therefore, I come to you today to make you see how important and beneficial it would be not only to each patient, but their families, doctors, nurses, and many others around them. Nonetheless, assisted suicide should be legal in all states, giving the patient the choice to suffer in pain and be forced to live through it. Thank you.